Are you avoiding calcium supplements because you've heard they might raise your risk of dementia, even though you're worried about your bones as you age?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and today we're examining new long-term evidence on calcium and brain health, why earlier fears missed the mark, and how nutrient balance helps you keep calcium working for you, not against you.
I'm Alara Sky. We'll walk you through what a 14.5-year investigation in older women actually found about calcium carbonate, then map out the specific cofactors and food strategies that the article outlines to safeguard cognition, circulation, and skeletal strength.
A large post-hoc analysis published in The Lancet Regional Health followed 1,460 women, age 70 and older, who were dementia-free at baseline. Half took 1,200 milligrams of calcium carbonate daily for 5 years. Half took a placebo. After another 9.5 years of follow-up using hospital and death records, there was no difference in dementia-related hospitalizations or deaths between groups. Even among women with atherosclerotic disease or a prior stroke, calcium use did not raise risk.
Those results directly counter earlier small observational reports that linked supplements to white matter changes or calcified deposits. The controlled dosing and adherence tracking here eliminate recall bias, and there was no signal of increased carotid plaque or arterial wall thickening in supplement users. The takeaway is straightforward. In this long-term context, calcium carbonate did not increase dementia risk.
The study also looked at adherence. Participants who took at least 80% of assigned tablets, regardless of whether they were in the calcium or placebo group, showed a 27% lower relative risk of dementia. That points to healthier behavior patterns, not calcium per se, as a likely driver of that difference. It underscores why you should evaluate overall habits alongside single nutrients.
So what should you actually do with calcium? The article emphasizes synergy. Calcium works best paired with magnesium, vitamin D3, and vitamin K2. When these are balanced, calcium strengthens bones and supports clear thinking. When they're out of balance, calcium is more likely to deposit in soft tissues, including arteries.
Vitamin D3 helps you absorb calcium from your intestines and regulate the hormones that maintain stable levels. The article highlights sunlight as central to this process and notes a target blood level of 60 to 80 nanograms per milliliter. It cautions you to avoid peak sun hours until you've eliminated seed oils for at least 6 months to reduce sun sensitivity and to test your vitamin D regularly to stay in range.
Magnesium is described as the regulator that keeps calcium moving into bones and teeth rather than into arteries. Low magnesium tips the system toward vascular calcification and metabolic stress. The guidance is to keep magnesium intake at about half of your calcium intake. So if you're at 1,000 milligrams of calcium, aim near 500 milligrams of magnesium, often requiring supplementation, because blood tests can look normal even when tissue levels are low.
Vitamin K2 activates osteocalcin and matrix GLA protein, which lock calcium into bone and steer it away from arteries. The article points you to natto, sauerkraut, and aged cheeses like Gouda and Brie as natural K2 sources. Pairing K2 with D3 and adequate magnesium creates the coordinated network that supports both bone and brain.
Another pillar is your calcium-to-phosphorus ratio. The piece recommends keeping it near 1:1 to 1.3:1. Modern eating patterns often drop to roughly 0.3:1 due to high intake of animal protein, processed foods, and sodas, each rich in phosphorus. When phosphorus chronically outweighs calcium, parathyroid hormone rises and pulls calcium from your bones to rebalance blood levels, weakening skeletal integrity and promoting arterial stiffness over time.
To manage that ratio, the article lays out concrete steps. Prioritize calcium-rich whole foods, such as raw grass-fed cheese and yogurt. Limit processed meats, fast foods, and colas that hide phosphate additives. Consider eggshell calcium to restore balance. Add a magnesium supplement to help regulate calcium transport. And get regular sunlight exposure to optimize vitamin D status.
On sources, the recommendation is to start with food-based calcium daily. Raw grass-fed cheese, Greek yogurt, cottage cheese, and cooked collard greens if you tolerate them. For an inexpensive supplement, the article outlines powdered eggshell, mostly calcium carbonate with trace minerals, at about 1/2 teaspoon 3 times a day with meals, providing roughly 1,300 milligrams of calcium. If constipation appears, pair it with magnesium as suggested.
If you supplement, the guidance is to use calcium strategically, not excessively. Most adults need around 1,000 to 1,300 milligrams per day from all sources combined, balanced with magnesium, vitamin D3, and vitamin K2. The piece also notes that your magnesium form matters. Start with magnesium citrate to find your personal threshold. Loosening stools signal you've overshot. Then shift to glycinate, malate, or threonate to maintain benefits comfortably.
Protein fits into this framework through its effects on phosphorus and connective tissue support. The article recommends about 0.8 grams of protein per pound of ideal body weight, approximately 1.76 grams per kilogram, and suggests getting roughly 1/3 of your protein from collagen sources, such as bone broth or grass-fed ground beef that contains connective tissue or glycine to support connective tissue health.
Pulling it together, the evidence presented dismantles the fear that calcium supplements on their own drive dementia. It shifts the focus to patterns: your vitamin D3 status, your magnesium sufficiency, your K2 intake, your calcium-to-phosphorus ratio, and your reliance on whole food calcium over isolated high doses. Those are the levers that keep calcium building bone and supporting cognition rather than burdening arteries.
Here's your challenge based on the article. Audit 1 week of your meals to estimate your calcium and phosphorus exposure, then take 2 actions. Add a daily serving of raw grass-fed dairy or cooked greens for calcium, and remove 1 phosphorus-heavy processed item like soda or fast food. Pair that with checking your most recent vitamin D level and aligning magnesium intake to about half your total calcium. Make those adjustments and track how consistently you can sustain them for the next 30 days.
Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.